Welcome. This is Doug McCall from the International School Health Network, speaking about a monitoring and assessment project developed by several members of the FRESH Partnership. The FRESH Partnership is a coalition of UN agencies, donors, and NGOs. This recording was prepared as part of an exhibit for the UNESCO Forum on Transformative Education, taking part in Korea in early December. This project on monitoring and assessing education programs which promote health and well-being has been supported by the nutrition program of UNICEF, as well as the preparation for it was supported by by a grant from the Public Safety Canada through the FRESH Partnership. Members of the FRESH Working Group on Health Literacy, Life Skills, and Social Inclusion have done much of the preparation for this study that we're going to talk about today. This slide, which is crowded as many of them are in this presentation, is looking at the background, the purposes, and the outcomes that we expect from the project that is underway. Our emphasis is on health and life skills education, which is a piece of promoting health and well-being. And we're suggesting strongly that the gaps and the confusion about health and life skills education have been both deadly and ironic. I'm very happy to have been working with Daniel Leitch from Simon Fraser University and Deepika Sharma from the nutrition program in UNICEF. This slide is a rough sketch of the overall ecology that surrounds schools, children, and within a society. I'm presenting it here because we're looking at monitoring what is happening in schools and classrooms, but we need to understand that the ecology around children, schools, and classrooms is quite complex and very, very layered. Earlier in the forum, you will have discussed, or the participants will have discussed, what we mean by transformative education. And we're suggesting here that we need to think carefully about those verbs, transform, or in other cases, reimagine. What are we transforming? And exactly what is the scope? A group of educator organizations, which has been asked by the FRESH Partnership to take a look at school reform, have suggested it's very important to look carefully at the process and the timelines of such things as transformation or reimagining education. And they suggest that we think carefully about rebuilding and refocusing existing school systems rather than trying to do something totally new. A reminder of that is the timelines involved in changing schools and curricula. It takes normally, within the context of a normal school year or normal school times, about 10 years to bring in one subject curriculum change, a new program, a new curriculum. However, we're talking about rebuilding after the COVID pandemic, and we're also looking at continuing the progress, which has been difficult at best, for goals towards the 2030 goals, goal number 4, education. And so the educators groups are suggesting that we move slowly and carefully and look at incremental change rather than transformative steps. This session is looking at monitoring and reporting and evaluating. And so here's a quick look at some of the practices involved in monitoring, reporting, evaluating, and assessing programs and practices and policies. The FRESH partners have developed a paper on that, which we call monitoring, reporting, evaluating, and improving. And the key point about that is that the steps of monitoring and reporting need to be linked to improvement. Otherwise, we're simply reporting, creating data sets or building reports that may or may not be read and may or may not end up on shelves. In this case, the project we're talking about is looking at two ways of monitoring and reporting. Right in the middle of the slide on a policy and program survey and the analysis of policy and guidance and curriculum documents. Another aspect of measuring and monitoring is what we're measuring and does it matter? Well, there will be a discussion in this session, which is looking at measuring health and well-being and 2 other concepts, but we need to make sure that we're not measuring something that is easy to measure rather than measuring what really matters. And as well, we need to think about not doing what many do, which is to try to have our program or our research monitored to make it matter with decision makers. We need to think carefully about measuring what truly matters. In this project, we're looking at those three items on the screen: inclusion and equity, school food and nutrition, and health and well-being. Inclusion and equity is now an overarching concept used by many in the education sector and other sectors, and so it's fairly self-explanatory. It is, however, complex and multifaceted. So we need to, but it is self-evident, and the importance of that can be accepted. School food and nutrition, a program that really looks at making sure that kids are able to learn because they have enough to eat and have good things to eat, is school food and nutrition. It's really easy to understand that starving children cannot really get to school, and hungry children cannot really learn very well. Health and well-being, which is mandated in most countries in different formats, is the best vehicle to teach vaccine literacy, hygiene skills, how to find reliable health information, especially on the web, how to use safety precautions, how to seek help when you're distressed, how to reduce stigma about seeking help, and about being primarily or fundamentally concerned about the health of others. All those things are really important, we've learned are really important during the COVID pandemic. And yet this is a subject that has not been well examined, has not been well monitored, it's not been well explained. So tragically, thousands of additional lives have been lost during the COVID or the extension of the COVID pandemic because of our failure to do those things: to monitor, report, assess, explain, describe, and understand health and life skills education. There are several gaps within that, within health and life skills education, which have been poorly researched. And one of them is that the monitoring process undertaken by several countries and by UNESCO and other UN agencies to monitor the Sustainable Development Goals, Target 4.7, has deliberately excluded or ignored health and life skills education. Page 14 of the document, which you can find by following the links from this slide, is an example of that. As well, the more recent report of the Futures of Education Commission has ironically, or rather has compared or confused physical education and sexual health education with health education. And since we're now in Korea, at least virtually for me, this is ironic because in 2015 at the Incheon Declaration, which was approved at the conference in Korea, health and life skills were deliberately added to the statement for student learning leading up to 2030. So the rest of the slide has identified some of the major problems in our understanding and practice of health and life skills education. I'd ask you to read them at your leisure and to come back in the slides, to the slide in the list of slides, which is part of the exhibit. This is another illustration of how complex or how comprehensive we need to think about health and life skills education. Health and life skills education is a pillar or a common piece of infrastructure in all the programs listed in this slide. If you look at the multi-component approaches, such as healthy schools, child-friendly schools, human rights, crime prevention, disaster risk reduction, and many others, there is always one core subject which is aimed at health and life skills education, or one core curricula that may be divided into different structures, curriculum structures, but one core piece. And on the right-hand side, you see a number of specific programs on specific health or social problems. And they all have one thing in common, which is health and life skills is a common piece of that. And so it's a really important feature to over 15 multi-component approaches and over 20 multi-intervention programs. This is another crowded diagram which tries to understand or explain the curriculum structures that exist. If you look at the bottom center of the page with those sun-like rising or setting sun kinds of diagram, this is a diagram that was used in the development of the monitoring for the SDGs. But our version of it has added many more domains or subjects, making it quite a crowded curriculum, crowded landscape already. The progress through the grades is pretty clear. The subjects, which is the second circle out of looking at civics and looking at physical education, looking at numeracy and mathematics, we're looking at arts and music and so on. Those domains are broken up into different subjects in different ways in different countries, but they're all part of a broad, holistic education that should be offered to all children. The third set of third layer out, which is a series of bubbles, if you look at, you have global citizenship, you have human rights, you have critical thinking, you have agency and self-efficacy, digital and media literacy, and so on, all the way around that scope. Those are what we call learning behavior models, which have been well researched and have much value in planning the curriculum and planning teaching and learning. One layer out in blue capital text, we have health and personal and social development, which is our expression for health and well-being. We also have education for sustainable development, ESD, and we also have global citizenship and education, which is GCED. Those are the three areas under discussion in this workshop. And we put them in here to show how they are connected. The next layer up in font that's been stretched over the page, learning to be, learning to know, learning to do, and learning to live together, comes out of the Dolores Commission report of 1996. And it's a way of talking about the purposes of education, which are intellectual, vocational, custodial, and socialization, as well as accreditation. And it's important to have a balance between those major functions across the curriculum to be able to have an effective school system. As several have already noted, there's been an imbalance created by emphasizing vocational and intellectual or academic aspects of the purposes of education. But the COVID pandemic has taught us that the custodial and the social roles of schooling are equally important. The last set of bubbles at the top of the page are worldviews or cultures. And as the Futures of Education Commission has reported, it's important to think about this because the cultural context in each country or state will have a big impact on the nature of the curriculum and the nature of learning. And in health education and health and life skills education, we've often used kind of a Western view, which is health as a personal resource, becomes a personal responsibility, kind of a possession. Where if you look at indigenous cultures, they see health as a connection to the land, but as a connection to their ancestors. If you look to Africa, Ubuntu, which is a way of saying I am because we are, is a tribal connection. And so on, there are other cultural views up on the top of that as well. In order to create a health and life skills education that is coherent with its context and all the way through the learning behavioral models into the subject structure that chosen by the country, all those pieces need to be coherent. The Fresh Working Group on Health Literacy, Life Skills, and Social Inclusion has been working over the past 2 years. And the website page is there on the top of the screen of the slide. And here are some of the documents that working group has produced. There are several. It has basically prepared a foundation for this study that we're going to be talking about on the next couple of slides as well. And you can see that there's scoping documents and definitions of terms and so on and so forth. And I invite you to come back to the slide and click on the links, or to go to the summary, introduction and summary that we prepared as part of this exhibit to find those documents and to read through them. Other Fresh Partner work that's important to refer to is also some excellent work done by, led by the Save the Children on low resource countries. And there's also a series of papers that was funded by Plan International. And those is another form of exclusion through our context in terms of the difficulties. So this is the background to our study. It's quite thorough, and we invite you to follow up on the links to read through those documents. Here is an infogram describing what we call health, personal, and social development education, or education for health, personal, and social development, or what in this session is called health and well-being. You have the child at the center, you have the core subjects around the children, you have the UN goals around that, and then you have a number of specific pieces bringing both formal classroom instruction as well as extended education outside of the classroom and all the pieces that relate to that. This is a broad, exploded view of what really happens, and it's an attempt to be able to examine things in detail. As well, you can see that the subjects of social studies and also sciences which are the core anchors for global citizenship and for global anchors for environmental health and for global citizenship are also in that inner circle. We're now coming to a quick look at the survey and document analysis that's underway. This is the project, to remind you, is being undertaken by UNICEF, UNESCO, the International School Health Network, and other partners, and led by Simon Fraser University, Daniel Leitch being the principal investigator. And as I said at the beginning, rather than a narrow focus on one aspect of the whole child or one program, we really took a broad lens approach to it, while at the same time looking at health and life skills education and one program, school food and nutrition. The fact-finding survey, as illustrated in the slide, will report on the status and structures and procedures and capacities of the multi-component approaches, and eventually lead into a discussion of what those capacities are and how they impact health and life skills education, as well as policies and programs. The report will have separate tabulations on low, middle, and high resource countries, as well as conflict and disaster affected countries. The document analysis will come out of the study. We'll look at policies and guidance and curriculum documents and other kinds of documents from education ministries, and in some specific cases, other ministries where that's relevant. The initial collection of documents will be made available to all countries, practitioners, and researchers through the UNESCO Resource Center. And initial profiles of each country, state, and province will be prepared and sent to respondents and to correspondents that we're hoping to have working in teams within each country. Again, thinking along the themes of if you monitor and report and assess, you need to think about improvements. Here are 3 activities that we're planning to follow up on the study, and we've anticipated and planned for these from the very beginning. Number 1, there is an international research network formed within the World Education Research Association, which will continue the work on defining and acting on a research agenda for health and life skills education. An event was planned for the conference of the American Education Research Association in April 2022 in San Diego, California. And then please find the information. I'd be happy to invite you to it directly if you're interested. It will be a virtual event. The second follow-up is a series of activities and resources that will be made available on school food and nutrition, coming out of the study and coming out of the survey and coming out of the document collection analysis. And these activities will be aligned with a larger set of activities and initiatives being led by UNICEF, the World Food Program, and other UN agencies and global organizations. School meals and school food and nutrition is a very big topic these days, especially following up on the COVID pandemic. And so we're going to fit in our activities to align with those and not duplicate those. The third project, and I'd invite you to find the document describing this, is a follow-up to the document collection process. We're hoping to have a Profiles and Pathways initiative, which would be following up on the example already done by UNESCO, which has a great collection of policies, national policies on inclusion. And we're hoping to have something similar and broader with collections of documents for each country on a whole variety of different topics that would be able to be useful for a whole different number of studies. Follow up on the links here to see the examples that we've collected for Manitoba, Canada, as a prototype of the type of documents that can be found for one jurisdiction, as well as a draft Manitoba profile, which gives you a way of how a profile can be created. And we're hoping to use those going forward. Thank you for your interest in this presentation, and I look forward to further information coming out from this session, as well as from the project. If you can follow these links to find those appropriately.